In the hospital environment, the medication formularies are primarily determined by a committee called the P&T Committee. This stands for Pharmacy and Therapeutics Committee. That committee is typically going to be driven primarily by the pharmacy department. So there might be a director of pharmacy and or a clinical coordinator that's really tasked with running the committee, organizing the committee and its agenda, and coordinating all the other pieces that require the committee or that are required by the committee when it comes to considering medications for addition or deletion from the formulary. And there's other members of the formulary as well. And it's typically going to be some of the key stakeholder prescribers, typically physicians that have privileges at the hospital, and perhaps other members of the hospital organization that have a vested interest in medication use in the hospital. So typically what happens is the pharmacy team is responsible for building a cost effectiveness analysis. They present the data to the committee, and there will be voting members on the committee that determine whether or not that drug gets added, or if there's a vote to change the formulary structure or remove a drug from formulary, etc. So along with determining what medications are actually on the formulary, this committee will often determine how that formulary is utilized within the hospital. So for example, there may be a protocol that every patient that gets admitted to the hospital on an ACE inhibitor gets automatically switched to the hospital's ACE inhibitor on the formulary. And there will typically be like a dosing chart that determines, hey, if a patient comes in on 10 milligrams a day of ramipril, that means they'll be switched to lisinopril at this dose per day. So that will typically happen for the most common drug classes that are used in the community setting. And then obviously all the medications that are used specifically in the hospital, your acute use medications, IV antibiotics, anticoagulants, sedatives, and things like that. The hospital will determine which drugs they'll keep on stock and what the clinical protocols and authorizations are to use those medications.